Hi, everyone. Good evening, or whatever it is where you are today. Uh, the recent shooting in British Columbia in Tumbler Ridge uh, is deeply troubling. And beyond the headlines and immediate investigation, I think there's a need for us to confront a harder truth. I keep thinking about this incident since it happened a few days ago. Uh, I joined myself with others to commiserate with the families who lost their loved ones. And I know this is a big one for this family. It's a very hard situation right now. One thing that keeps coming to my mind is that anywhere we see youth violence is often a symptoms of systemic mental health failure. As a clinician working in mental health and crisis contexts, I have seen firsthand that severe behavioral escalation rarely emerges overnight. It is usually preceded by layers of a couple of things. For example, unaddressed depression or trauma, emotional dysregulation, social alienation, family stress, digital exposure to aggression, and of course, delayed access to care. This is not about excusing behavior, it's about understanding prevention. There are a few things I feel it's very important we do that can help us salvage the situation we are right now. There's a need for all of us to move from reaction to early intervention. You know, whenever things like this happen, everybody begins to react, including the government. Let me say this, that in Canada, youth mental health services remain overwhelmed. Wait lists are long. Support is often crisis-driven. Many adolescents only receive meaningful intervention when risk has already escalated. I feel that we need structural reform in 4 areas. Now, number one, there is a need for us to embed mental health in schools. Mental health professionals must be integrated into school systems with sustainable funding. Early screening, trauma-informed education, and accessible counseling will reduce risk long before crisis. Number two, there is a need for family-level support. Youth mental health cannot be separated from economic stress, parental burnout, and intergenerational trauma. Family-focused intervention are not optional. They are protective. And I think if there is a time for us to put this in place, I believe now is the time. Family-level support is very, very important and needed in time like this. Number three, responsible digital ecosystems. I feel there's a need for us to take seriously the psychological impacts of algorithm-driven exposure to violence and social comparison culture. Policy and parental guidance both matter in time like this. There's a need for us to control this, to be responsible when it comes to the way our youths, young adults are, especially teenagers are using digital platform. Another thing I feel, the fourth place aspect I feel there's a need for us to make some shift is community and the faith-based collaboration. There is a need for community and the faith-based organization to collaborate. Community leaders, including clergy like myself, youth mentors, and youth ministry, need mental health literacy training. Spiritual care and psychological care should not operate in silos. Integration saves life. So if there's a need for collaboration, I think now is the time to collaborate. This is a public health issue. When youth mental health deteriorates at scale, society absorbs the cost. These only happen to families over there. We don't know where this is going to happen next. So, and with this, there is a cost attached to what has happened because education of people have been disrupted. It brings healthcare burdens, criminal and justice involvement, and community trauma. That is what the society absorbs. That is the cost. I was reading the news this evening, and the news says the students in Tumbler Ridge are not even ready to go back to school. That is the cost. Prevention is not merely compassionate, it is fiscally responsible and socially stabilizing. So I think this is a clarion call to policymakers, educators, clinicians, parents, and community leaders to collaborate, not retreat into polarized debates. We can't wait for the next incident to express concern. I feel there's a need for us to build systems that identify risk early, respond decisively, and of course, treat youth mental health as a national priority. This is what is going to save our country and our nation. Our teenagers do not need more headlines. What they need is access. What they need is stability. They need adults willing to act before crisis. This is very, very important. It's a very sad situation. And yesterday I saw the Prime Minister of our country and other political officers visited this city to commiserate with them and to be part of what is going on there. But we can do more. That is not enough. We can do more. It's a sad story. And I want to encourage all the parents to pay special attention to their young adults so that we can put end to this menace in our society. I hope this will get to someone and it will get to someone. Feel free to share this and it can be a blessing to somebody listening to it. Thank you everyone for listening to this. It's just a short one. Thank you.